What do we need to know about future pandemic risks? How can we all be better prepared for the next pandemic? Seasonal influenza is familiar to most people, but pandemic influenza is far more disruptive. In a pandemic scenario, a new influenza A virus spreads through populations that have limited or no existing immunity. The influenza virus is transmitted primarily through respiratory droplets, making households, schools, and crowded indoor spaces major hubs of spread. Past pandemics have shown that roughly 1 in 5 people become infected during the outbreak. Each infected person typically passes the virus to 1 or 2 others. The flu moves quickly. The incubation period, the time from exposure to appearance of the first symptoms, is around 2 days, and the generation time, the interval between one person becoming infected and then infecting others, is about 3 days. A number of groups face a higher risk of severe disease for influenza. These include infants, older adults, pregnant individuals, people with significant comorbidities such as obesity or chronic health conditions, and those living in socio-economically disadvantaged conditions. Preventing the spread of influenza relies on both medical and social measures. Vaccination remains the most effective tool, especially when the vaccine has been updated to protect against the latest version of the virus. Non-pharmaceutical measures, such as wearing masks, improving hand hygiene, limiting large gatherings, and closing schools temporarily, are essential community-based measures for managing influenza outbreaks. With a warmer climate due to climate change, another health crisis scenario becomes more likely in Europe. Dengue outbreaks often flare with warm temperatures because mosquitoes are the transmission engine. Aedes mosquitoes thrive in warm climates, and warm temperatures shorten the virus's development inside the mosquito. Like influenza, only a fraction of people become symptomatic. The disease unfolds more slowly than influenza. The intrinsic incubation period of humans is 4 to 10 days, and overall generation time is around 19 days, reflecting the extra step of transmission through mosquitoes. The groups most vulnerable in severe dengue differ from those in an influenza pandemic. People are at particularly high risk if they were previously infected with a different dengue serotype, which can lead to a more severe disease. Other vulnerable groups include people with chronic conditions such as diabetes, cardiovascular disease, and renal disorders. Preventing the spread of dengue focuses on controlling the mosquito population and reducing contact between humans and mosquitoes. Vector control measures such as larviciding, treating standing water to stop mosquitoes from growing, fogging, spraying a fine mist of insecticide into the air to kill adult mosquitoes, and the introduction of Wolbachia-infected mosquitoes, a bacterium which reduces their ability to spread diseases, can significantly reduce transmission. Community actions, including eliminating standing water around homes and using repellents or protective clothing, are essential complements to official control efforts. Influenza and dengue scenarios are markedly different in terms of disease dynamics, transmission pathways, and outbreak control strategies. However, in both cases, community-based actions remain essential to reduce disease spread. The PREPSHIELD project is an EU-funded project that aims to improve health crisis preparedness and response by involving society as a whole in health crisis management. Learn more at prepshield-project.eu.